Hello, 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 everyone, and welcome to the last day of Diabetes Awareness, day 30. So, I am Yvette McQueen, MD, emergency physician and travel doctor, a global physician on a mission to educate about health, travel wellness, and disease prevention. So, I'm here on day 30. It is the last day of Diabetes Awareness Month. I'm so glad you can join me. If you have not looked at any other ones, you can go back. I'm going to leave them all up for probably another month. So you can go from day 1 to day 30. So today is a wrap up. Wrap up. So, what was the whole point of diabetes awareness? The whole point of the diabetes awareness was so that you know about diabetes, that you get some good scientific information along with uh, lifestyle information. It's for prevention and management for yourself, your family members, or anyone else that you know. So remember, I said there's 34 million Americans that's out here with diabetes. One out of five don't even know it. One out of three has pre-diabetes, which means they're headed toward type 2 diabetes. So it's very important. And people are getting younger and younger. Before, they always felt that it was something you got in your 40s or 50s, but I'm diagnosing people in their 20s with diabetes. And before, it was just with primary care doctors. I'm diagnosing people with diabetes in the emergency department. So the first time they show up, the first time they know that they actually have diabetes, ooh, there's a hair, sorry, ooh, is when I tell them, which is phenomenal for them. Okay, so hair on my face, live TV. Okay, here we go. Diabetes. Diabetes is about elevated blood sugar in your blood. Basically, we call it glucose. Elevated blood glucose is because it's not managed appropriately by your body. And that's because, so there's type 1 diabetes where people get it because their pancreas, and the pancreas is an organ that sits behind your stomach. The pancreas does not produce insulin or enough insulin to handle basically the glucose that comes into your body. Type 2 is that you do produce insulin, but your cells don't recognize it or it's not working effectively. So it leaves high glucose levels in your bloodstream. And then there is gestational diabetes where people have elevated blood sugar and diabetes characteristics while they're pregnant, and it goes away after the delivery, but they have the risk of having large birth babies, which means C-sections, or they're at risk to get type 2 diabetes later on in their life. So, diabetes. So, is basically when you eat food, you produce glucose. Glucose is that one that all the cells needs, that one ingredient all the cells need for energy. You eat glucose, carbohydrates, particularly, but other things, and it breaks down to glucose, and the cells take it, gobble up, and say, "Oh, okay, I can do what I need to do." It's called your metabolism. So if you have extra floating around your blood, it puts off some symptoms and it starts to uh, wreak havoc on your other organs, basically. How do you know you have diabetes? Some of the risk factors or the signs are we like eat too much, but still losing weight, uh, always thirsty, and always peeing a lot. Those are some of the key symptoms. Also, if you get like dark skin, we call it around in your armpits and around your neck, where you get hyperpigmented. Where you dry skin, believe it, excessive dry skin actually is a sign of diabetes. You getting lots of yeast infections. You don't realize a yeast infection, not only vaginal yeast infections, but under the breast and the armpits, the sweaty areas, you get a lot of yeast infections. It's you don't have good wound healing. So you have blurry vision, and you have tingling and not numbness, but that tingling, painful feeling in your extremities, particularly in the legs and feet. So when a doctor tests you for diabetes, we take blood. So we're checking if you're fasting. Fasting means you haven't eaten for 8 to 12 hours. We check it, and your fasting should be under 100. For diabetes, if you've eaten, we take it 2 hours after you've eaten. It should be anywhere. It should be like 120, no more than 140. If you have a blood sugar after you've eaten and it's over 200, that's automatic diabetes. We also like to check what we call the hemoglobin A1C. It's a little molecule that sits on your red blood cells. And your blood cells last for 90 days. So we're able to tell the average of what your glucose has been doing over the last 90 days or the last 3 months. So when people come and they say, oh, I'm getting my fasting and I'm doing good, I'm like 140 and 120. And I'm like, yeah, but your hemoglobin A1C is 10. So that means that you just did eat yesterday. So one of the things I tell patients, don't lie, because if we got to help you out. And the only way we can help you if we know the truth. So your hemoglobin A1C, here we go. Here's the numbers you should know about hemoglobin A1C. 5.6 and below is normal. It's a percentage. 5.6 and below is normal. 5.7 to 6.3 is pre-diabetes. And over 6.4 and over is considered diabetes. You will be diagnosed with diabetes, placed on medication. So sometimes they place you on medication pre-diabetes. Pre-diabetes also can be managed with what I call lifestyle modifications. That helps you so you don't progress onto that way. So some of the medications people are placed on, usually they're placed on, let's see, the pills. There's metformin and glyburide that you take. You take it twice a day, or some people do it once a day, but most people take it twice a day. They also want you to check your blood sugars. Now, there's a different way to check your blood sugars. There's the pinprick that most people know. They pick their fingers and use what we call glucometer. There's a new one out now that you put it on your arm, a little disc on your arm, and you use your smartphone and you wave it, and it always is testing your blood sugar. That is like ingenious. So that's something people should look into if you're diabetes, particularly type 1s. Type 1 sometimes have to wear an insulin pump where is implanted, put on their side or their stomach, where they're steadily getting insulin at a steady amount because their blood sugars go up and down, up and down. And it's also reading their blood sugars so they know how much is given. You may also, if you're type 2, you may also be placed on insulin. There's different type of insulin, short-acting, long-acting insulin that you can take. You just take once a day or twice a day. You also may be placed on another medication that affects the pancreas to increase the production of your insulin or make your insulin more effective. And that's a once-a-week drug. You've probably seen commercials on all these drugs, and they'll tell you about it. I can't even think of the commercial. They're always moving and catching footballs. The guy that's doing this, eating right, and all that. Yeah, those are very effective drugs because some also drugs protect you. They say are cardioprotective. So when if you have diabetes, the cousins, I say, it's heart disease and hypertension. They run hand in hand. So we always check people for heart disease and hypertension along with diabetes because they like to run together. So the medication for diabetes also being cardioprotective, excellent. Your doctor usually manages your medications. Your primary care doctor will manage your medication. If they feel they can't manage it at what we call more aggressive diabetic, they may send you to an endocrinologist, which is a doctor that deals with hormones, but very specialized with diabetes, hypertension, and other hormone-related chronic diseases. So, okay, so we talked about, let's see, you are at risk for diabetes. If you don't have diabetes yet, you're at risk. Some risks you can change, some risks you can't change. You are at risk for diabetes if it runs in your family, mother, father, sister, brother, aunts, and uncles. Can't change that. It runs in certain ethnic groups, African American, Latino, Pacific Islander. You can't change that. It runs in the, but it will affect with obesity. It will affect with your lifestyle, what we call the metabolic syndrome, particularly our eating habits um, for that. So, also, if you do have it, like I said, I gave you some things where you're peeing a lot, eating a lot, still losing weight, blurry vision, poor wound healing, yeast infections. Go to your doctor, have you get tested, see if you have it. If you need to be placed on medication, please take your medication. Um, and also, when you go to the doctor, tell them, look, I want a diabetic educator. A diabetic educator will educate you about the medicines and other things like the lifestyle modifications, things to change. They will give you a nutritionist to start talking about your food intake, food exchanges, and things you need to change differently about your eating habits or your behaviors to actually effectively help you with diabetes. We call those lifestyle modifications, where one, yes, you get to get physically active. Get physically active, where you're doing something 30 minutes every day. Take a walk, get your vitamin D outside, but do something physically 30 minutes every day where you're eating three main meals a day with small meals in between, only 100 calories. Some people calorie count. They'll put you on a calorie diet, like a 1500 diabetic diet. But it does not mean you have to go hungry because you have to do things like half of your plate should be fruits and vegetables, make it colorful. Protein should only be 4 ounces or decacard, your fist, palm of your hand, and carbohydrates, certain carbohydrates, you will have to change. And when the processed food, go to the sweet potatoes instead of white potatoes, the wheat bread instead of the white bread, um, veggie pasta or wheat pasta, those different things. And that's what a diabetic educator and nutritionist will show you how to do the change. I also suggest that you go to my plate, choosemyplate.gov, which is very helpful. And you can actually plan out meals and diets for yourself according to your weight and health issues. You can use that. So that's what you need to do. Those are lifestyle changes. Of course, decrease your stress. Stress will increase your cortisol level, which increases your sugar, put you at risk, increase that belly fat, which increases the cortisol level. It ends up being a cycle and increase your blood sugar level. Decreases your immune system because then you'll be more susceptible for illnesses, viruses, and so that's why you want to keep your blood sugar under control. Want to keep the blood sugar under control because the complications, what will happen? Complications are, of course, heart disease. Blood sugar affects your blood vessels, particularly tiny blood vessels, but it will affect your heart. So heart disease, people get heart disease. They get blindness in the eyes because of the blood vessels back there. They get kidney disease. It affects your kidneys a lot where the blood vessels there, and some people end up getting on dialysis because of it. It affects the small blood vessels like in your feet, and also the neuropathy affects your nerves. You don't feel things, and you end up getting wounds. Wounds won't heal properly, and that's where they start to fester, get in the bone, and you end up having gangrene, end up having amputation of toes, feet, and leg. So that's some of the complications of diabetes. That's some of the quick complications of diabetes. Other doctors you should see if you have diabetes is, of course, is the podiatrist. The podiatrist, your primary care doctor, endocrinologist, and your senior endocrinologist. Your podiatrist is about the feet. They'll take care of the feet. They'll look at things, ingrown toenails, things like that. You should never, if you have a pedicure, never have scraping of your feet because then you won't know if there's a wound there and you won't feel it and it'll fester. You should see a dentist every 6 months because oral disease. Oral disease affects a lot of things like diabetes and heart disease, and people don't realize that. So do good oral care, brush your teeth twice a day or after you eat. So I take those little mini toothbrushes. Those are great to take if you're at work, have a little pack at work to have your little mini toothbrushes for after lunchtime. or rinse your mouth out good so that it cleanses all the extra food and things aren't getting, because you get oral disease and gum disease. So you should see a dentist every 6 months. See an eye doctor, because, like I said, it affects the small vessels in the back of the eye. Retinopathy, what we call retinopathy, hit your retina, which is actually the eyeball, and it's at the back of the eyeball. That things shine in and bounce, and that's how you see. And you should see an eye doctor regularly and get, me, I've been wearing glasses since I was 6. So I go see the eye doctor and make sure I make a regular visit to the eye doctor. All right. We did a lot. That's a lot. That's a lot this month. I talked about, and if you also are diagnosed with diabetes and you feel like it's death sentence, it's not. People are living effectively and regular lives with diabetes, and they're not going hungry. If you have to change your eating behaviors. But if you feel that it's something that you don't can handle, ask your doctor to refer you to someone to talk to. Talk to a psychologist about the diabetes and how it affects your life and how it's going to affect your relationships. That's very important. To also hit the social, spiritual, mental, intellectual aspect of your disease. And that's where I talk about wellness. Wellness is just not just the physical part, it's your health, it's all the integral parts of everything that you do in your life. And it'll affect your job, it affects your finances, because now you got to buy medication, what type of insurance you're going to have. So those are things that you have to sit down and discuss and plan out once you're diagnosed with a chronic disease. And it all affects you and it all intertwines together. And that's why I like to teach people wellness. So that's my overview. And here's my pitch, people. I am a wellness lifestyle coach. But I mean, I like to educate people about health, and you can see all my other videos. I'm just educating you because I believe if you are a participant in your health, you are partaking in your health, then you will live your best life. So my website is YvetteMcQueenMD.com. That's YvetteMcQueenMD.com. So you can go there for my services, schedule a consult, a strategy session. If you have a chronic disease you want to talk about, if you have diabetes you want to talk about, and we can see how wellness, I'm not a replacement of your physician. I don't plan to be I'm not a replacement for your physician. Follow your physician instructions. I just want you to be able to incorporate wellness in all parts of your life. So you can find me, YvetteMcQueenMD.com, and all social media, Yvette McQueen MD. That's my wrap up for Diabetes Awareness Month. Next month, so tomorrow is December. We'll see what's going on there, and follow me, and I can tell you about other diseases, other wellness, other tracks, and we'll go from there. And remember, be a participant of your healthcare and live your best life. Ciao for now. Peace and love. Stay safe.